Next. From now on, I will shortly talk about African horse sickness. The African horse sickness is not yet outbreak in Korea, but it deserves to be taken eye on them. The African horse sickness is a viral insect-borne disease affecting equine species caused by AHS virus, a member of the orbivirus genus. The disease occurs commonly in sub-Saharan territory, particularly in South Africa. It frequently affects horses, mules, and donkeys. African horse sickness in leaflets, it looks like that. The donkey 10% and the mules 50%. The horses almost up to the 95% can be affected once the AHSV arrived that region. The orbivirus family. I'd like to talk about the orbivirus family. The orbivirus family belongs to the Reoviridae family and includes several viruses that primarily infect animals, particularly livestock and wildlife. They're transmitted by arthropod vectors like midges, mosquitoes, and ticks. The most well-known viruses in the orbivirus genus include the following slides. Now, these orbiviruses are significant because of their impact on the agriculture and animal health, especially in the regions where midge vectors are prevalent. And mosquito are prevalent area. In case of that, the people who lives in the midge vectors are prevalent. Take an eye on the monitoring vectors. The first orbivirus family first, the blue tongue virus. So one of the most studied orbiviruses and caused the BTB, blue tongue virus in sheep and other ruminants such as cattle and goats. It leads to symptoms like fever, swelling of the mouth and tongue, and can be fatal, especially in sheep, and transmitted by the culicoid midges. And the second one is the African horse sickness virus, the severe, often fatal disease in horses, donkeys, and zebras. It leads to respiratory and circulatory issues, and in its most severe form, it can result in high mortality rates in horses. Like BTV, AHSV is transmitted by culicoid midges, the so-called mosquitoes. And episodic the hemorrhage disease virus, the primarily affects wild and domestic deer and sometimes cattle. The results in fever, hemorrhage, and in severe cases can lead to death. Outbreaks occur mainly in North America and also transmitted by the culicoid midges. Look at this. The species affected. Some foams. The horse just to spread up the nasal discharge, the foamy nasal discharge or the mouth discharge, and then just sick, very sick, and then just lay down and a foamy the fluids discharge outside of their bodies, and then just died. Equidae, the species affected equidae, the horses, donkeys, mules, and zebras, and others include the camels and dog. Geographic distribution said endemic in sub-Saharan Africa. The red color is endemic area. It's a very endemic in sub-Saharan Africa, and the outbreak. The purple one is 1959 to 66. Is in the North Africa and the Middle East, the Near and Middle East, and European countries as well. And the 1944 here, the European countries and Near and Middle East. The Korea is currently free from AHS. African horse sickness virus is the Reoviridae orbivirus, as I talked to you in the previous slides. The double-stranded RNA genome it has on non-enveloped and spherical virion, 80 nanometer in diameter, and not that big. It is a relatively small virus and possesses the 3 concentric capsid layer and they're all icosahedral, the outer and the middle and inner capsid, the 3 layers. And the genome consists of double-stranded RNA divided into 10 to 12 segments. It means that between segments it can be reassortment together. And 9 serotypes, 1 to 9, and all viscerotropic. The ones that they get infected by AHSV, all viruses are viscerotropic, organtropic. And the serotype 9 were an endemic area, the outbreaks outside of Africa. And the serotype 1 to 8 delimited the geographic areas. Transmission was caused by the culicoid, the mosquito, the vector-borne, and it is not contagious disease, only by the vector-borne disease. It is a take noteworthy. A couple of strains of culicoids can be included in this vector-borne pathogens, and viremia in equidae, presented by the horse for the 12 to 40 days, and zebra African donkeys and up to 6 weeks. Yeah, the pathogenesis is a bite of vector-borne that takes virus into subcutaneous tissues, then migrate to the nearest lymph node and then to systemic circulation to go to the viscerotropic. And mainly deposits on heart and lungs along with this systemic deposition. Then the virus localized in places will produce many lesions, just like that. The clinical signs and AHS incubation period, it is important to remember. The experiment, in case of experiment, the incubation period is 2 to 21 days. The LSDV also has a very long duration of incubation period. It means once the mosquito bites, and then almost 1 month incubation period, and then the bitten animals present their clinical signs. During that time, those animals can go anywhere. The animals can travel. So it's I think it is take noteworthy thing is once the LSDV clinical signs are presented, and then the standard still, I don't know it is really effective or not, because vector bite, and then 1 month later the bitten animals present their clinical signs. So we it is, I think it should be thought the one more time. Okay, anyway, the experiment is 2 to 21 days, and the natural infection is the up to the 2 weeks, and the 4 forms of the disease. It's a peracute and subacute and acute, and the horse sickness fever. Incubation period is depending on the disease form, that are slightly different, but the longest day is 14 days. And symptomatic infections most common in horse and mules, and zebras, and typically asymptomatic, like avian influenza in dunk species. And the peracute can be said in simultaneously the pulmonary form, the form from the nearest due to pulmonary edema. The form means a pulmonary edema, and the pulmonary edema looks like this. The lung itself is very shiny because of the edema, the fluids, and the interstitial spaces are filled with the water. The acute fever, the peracute form, acute fever is sudden severe respiratory distress and dyspnea, tachypnea, the profuse sweating, spasmodic coughing, coughing severely, and a frothy, and a serofibrinous nasal exudate, and a rapid death. in a few hours. They died. In the subacute and edematous cardiac it is called in the edematous and the cardiac form. And if the animal recovers, swelling subside over the 3 to 8 days. And anyway, the subacute form caused death as well, but death was within the 48 days. It is take noteworthy. The conjunctivitis can be appeared here in case of edematous and cardiaform, the subacute AHS. And the acute and mixed form means pulmonary and cardiac forms. The cardiac form is, I'd say, cardiac form can be said as a subacute form of this disease. Both organs get damaged, and the cardiac signs usually subclinical, followed by severe respiratory distresses. The severe respiratory distress appeared as a frothy and a foamy discharge from the nares. So in case of for the veterinarian going to the farms, and the horse very distressed dyspnea and tachypnea with frothy and foamy nasal discharge, you have to think suspicious. What if the animal can be affected by the AHS? And the diagnosis confirmed by necropsy. The horse sickness fever is a mild clinical signs. Characteristic fever, the 3 to 8 days. The morning remission, in case of in the morning, that the fever is just gone, undetectable. Afternoon exacerbation again. It is very characteristic fever. And the other signs are mild anorexia or depression. It is not typical. Every disease can be appeared in mild anorexia and a depression, but not characteristic. But it is important to note. And congested mucous membranes and increased heart rate, and the horse sickness fever is rarely fatal. Morbidity and mortality. The mortality is half of mortality in case of the horse, and the mules half. The European and Asian donkeys, and up to 10%. African donkeys and zebras, rarely they die. And mortality based on form of disease. And the pulmonary form is, in case of the pulmonary form, the mortality is up to almost 100%. The cardiac form is 50, the half, and the mixed form is 70 to 80%, and the horse sickness fever typically recover. Lesion looks like that. Edema. The pulmonary edema is characteristic. It is important to note. Then okay, for this, so only the pulmonary edema was the characteristic lesion of this disease. Keep in mind, please. The histopathology again. So you can find out there are the virus inclusion bodies. Again, and virus inclusion bodies and histochemistry can say there are a lot of the viruses inside of the organ. Control and prevention is insect repellents. Vector control is the most important, and the prevention can be done by vaccination, because there are vaccines. Vaccines are available.